Alright, so my name is Imani Robinson. I'll be doing my head, ears, eyes, nose, and throat exam in addition to my cardiovascular exam. Here is my patient for today. I'm going to start off first by doing the HEENT assessment. So first things first is I am going to inspect the head in the face, just check for symmetry, see if there's any facial drooping. I'm looking at the head, I'm palpating for any abnormalities, any swelling, any masses. I'm also looking at the scalp for any discolorations or any skin tag moles. Also, when we had anything that's abnormally large, and again, symmetry. I do note that there is some balding in the top anterior portion of the head. Just, I would imagine it's just with normal aging, so I'm not concerned much about that. Next, I am going to look at the face just to see if there's any abnormalities, facial drooping, there are any skin changes that maybe suspect some type of melanoma. Look at any excessive hair growth, especially in women. If you notice anything like that, that would be something that you would want to note. Next, I want to look at the eyes. I'm going to inspect the eyes, and when I inspect the eyes, I am going to sit down and kind of get at face level with him, and I'm going to have him look directly at me. And right now, I'm just kind of checking for the level of the eyes, just making sure everything is aligned, height. Also looking my pen light, I'm going to assess for pupillary reaction. So I'm going to have him look directly at my nose, and I'm going to see if the pupil constricts while I compare with the other eye. I'm going to do the same thing with the left eye. Pupil constriction looks like pupils are reactive to light. Also, I'm going to have him look directly at my nose. I'm going to inspect for extraocular movement, which are cranial nerves 3, 4, and 6. So first things first, I'm just going to have him look at my nose, and then we are going to, I just want you to use your eyes, and you're going to follow where the pen goes, just your eyes, not your head. And this is our 6 cardinal signs we're checking for. Is there any pain or discomfort when you move your eyes? You notice any pain or discomfort? You guys, so I'm checking to see if there's any wobbling of the eyes. I want to see if there's any like ptosis or there's any nystagmus of the eyes, anything that may suspect that there may be some ocular things going on. Also, what I want to do is I would like to do the eye chart, and what I'm going to do is stay about 2 to 3 inches away from him, and I'm going to have you cover one eye. I'm going to have you cover, okay, so you can cover that as your left eye. So I'm going to have you read at the lowest line you can read, the smallest line you can read, and just read all those letters for me.
LTFPH.
Okay, so for his right eye, there's 20/20 vision, so I'm going to have you cover your other eye, your right eye, and I'm going to have you do the same thing with your left eye.
LTFPH.
So it looks like he has 20/20 vision in both eyes. Now we're going to look into peripheral vision, and what I want you to do is the same thing. I'm going to have you cover your right eye. Okay, and what I'm going to do is I'm going to put up either fingers 1, 2, or 3, and you're going to tell me which number you see. So
1, 2, 2, 2, 1.
okay, I'm going to have you cover your other eye, left eye, and we're going to do the same thing. So I'm gonna have you tell me.
2, 2, 3. Sorry. 1, 2.
Okay. So that's how we assess for peripheral vision. Looks like he's able to see his peripheral vision is intact. There's no issues there. Next, what we want to do is I'm going to have him do the cover uncover test. And what this is going to assess for is this is going to assess for, like I said, any type of ptosis or any type of like wandering of the eyes. So what I want to have you do is I'm going to cover one eye with this. And just need you to look straight at me at my nose. And when I do this, I'm just going to look to see if there's any introverting or extroverting of the eyes. Same here. Nope. So it doesn't look as if that there's any issues with the eyes in that respect. Then I am going to, like I said, check the height of the eye. Just going to look to see if there's any abnormalities. Now I'm actually going to examine the eye. So what I'm going to do is I'm going to come over on the side, have you look straight ahead. Let's see if I see anything. Nope, no clouding, no shadowing on that side. Okay. So have you look at me. I'm going to look in the eye. I'm going to look at the conjunctive eye to see if there's any redness or any swelling, or while looking at the sclera to see if there's any foreign bodies in the eyes, any redness, any edema. Looking at the eyelids as well, see if there's any abnormalities there, swelling, edema, all those things are negative. Also, the next thing I'm going to do is I am going to look at the, let's get confused with this. I want to look at the ocular alignment of the eye. So when I look at the ocular alignment, I'm going to have you look straight, just to glare kind of off into the sky behind me. Just look straight, just straight, but you want to look behind the glare. You're looking upward, but I need you to look straight behind me. Like straight behind me. Yeah, like keep your eyes at my eye level, but look, stare off. And what I want to look for is I want to see when I shine the light midline into his eyes, do I see the glare at the same location in each eye? Which I do. So ocular alignment is fine bilaterally, no abnormalities there. Also, I want to inspect the actual eyeball. I want to look at the retina. I want to see if there's any cotton wool bodies. I want to assess for any papillary edema, any abnormalities with the eye. So I'm going to come up close to you, and hopefully light comes on onto set it. Okay, I'm going to have you look. Okay, so negative on exam, there's no hemorrhaging, no busting of the blood vessels. Things that seems to be ocular intact. Looked at the iris seems to be in place. The cornea looks good. We checked the ocular fundus. Like I said, now we're going to look and inspect the ears. So let me switch out. So first, when looking at the ears, you kind of just want to look to see if there's any obvious abnormalities, I should say. So just kind of going to inspect the ears and look to see if there's any swelling, if I see anything draining from the ears, any redness of the ears. So first I will have him look over to the right, and I'm just going to do an overall inspection of the ears. I'll look on the outside of the ear, checking for any impactions, any redness, any lesions, any abnormalities in the ear. And I am going to go into the canal, back, kind of check the tympanic membrane, check for color, texture, redness, escalating. Just look into the canal. Looks good. This side doesn't appear to be any rupture to the tympanic membrane. Has the right appearance, the curly grayish appearance, no excessive redness. We do have some wax in the ear. Everything looks intact. There is a bit of wax in the left ear, so. But other than that, no major abnormalities of the ear. Also, I am. So now what I want to do is I am going to do hearing acuity. First, I'm going to start off with doing hearing acuity. First, I'm going to start off with doing the hearing test, which is the whisper test. So I am going to whisper in his ear, and he's going to repeat what I whispered to him.
Good morning. Good morning.
So in this instance, he passed the whisper test. So usually you wouldn't have to do a Weber or a Rhine test. Those are usually only done if there is hearing acuity issues that may be suspected. But in this case, just for the sake of learning purposes, we will do the hearing acuity. So we did the whisper test. First we'll do the Weber. And what we'll do is we'll kind of tune the fork like this. And I'm going to place it on his forehead, and you're going to tell me if you hear the sound evenly in both ears. Or do you hear it louder on one side and louder on the other? Okay, I'm going to do it again. I'm going to tune the fork. I'm going to put it on your arm. Tune the fork, put it on your forehead, and you tell me if you hear it evenly in one ear or it's louder in one ear over the other. You don't? You hear anything, any buzzing? Okay. Alright, so in that particular test, he wasn't able to hear anything on either ear, so I'm not sure why. So what we will do is we will try the Rhine test, where we will do air versus bone conduction to detect hearing loss. So I will put it on the mastoid process. Let me know when you can't hear it anymore. Can you hear something? You stop hearing it now?
I hear that.
Tell me when you can't hear it
Can't
anymore.
hear it.
Okay. Same thing over here. I'm gonna tune it. Tune the fork. place it on the mastering process. So I'm almost here. Alright, so it seems as if air conduction may be greater than bone conduction, which would be a normal finding. So it seems as if there are no impairment hearings. There are no hearing impairments noted with this exam. Now, next thing I want to do is I want to inspect the nose. I'm going to look at the nose and I just kind of want to do a once over. I want to inspect for abnormalities, any type of redness, any type of swelling, any type of drainage. So now I'm going to go into the nose and just kind of inspect around and see for any redness, swelling, polyps, things of that nature in both noses. Let me get you a bit closer. Okay, so nothing abnormal there. Next, I'm going to have him open the mouth. Just kind of look around in the mouth. I'm looking at the lips, checking for dryness. Looking around at the oral mucosa, looking at the teeth, seeing any cavities, abnormalities, looking for lumps or lesions. Going to look at the hard palate, soft palate. Lift the tongue up for me. Around the base of the tongue. Alright, I'm going to have you hold your mouth out. Say ah. Flip your tongue out from side to side. So I'm checking for symmetry. See if there's any swelling, abnormalities with the tongue, difficulty sticking the tongue out. Now I'm going to check for the gag reflex. Stick the tongue out. Okay, that's what we wanted to happen. So there's a positive gag reflex. Okay, also, let's see. Let me make sure we looked at the throat. I want to have you lift your head up and just swallow for me. Okay, one more time. Swallow for me. Alright, so I just want to inspect him swallowing. So that looked at all the cranial nerves. I'm going to palpate the carotid artery. And really felt equal bilaterally. Okay, no issues there. Now I am going to inspect and kind of look at the neck, check the lymph nodes, see if there's any swelling around in the neck, any abnormalities, no swelling, no lymph nodes noted. I'm going to look at that. The thyroid, see if there's any goiters, abnormalities noted, any pain or anything when I palpate around your neck or anything. The ears.
Nope.
Okay. Alrighty. So that concludes my head, ears, eyes, neck, and throat evaluation. Next, we will be doing cardiac and we'll evaluate. So first things first is I am going to inspect and kind of look at his general appearance, look at his skin, see if there's any cyanosis, see if he's diaphoretic, anything to suggest that there may be some type of labored breathing or some type of instability. Skin looks warm, dry to the touch. Next, I want to look at the lips. The lips are normal color. I don't see any cyanosis, anything that suggests that there may be issues with ventilation. Also, I am going to just have him breathe regularly, and as I'm looking at him breathe, I'm just going to check chest symmetry just to see when he inhale and exhale if everything's even with the thorax. If there's anything that may be suggested of a pneumothorax or hemothorax or any of those things. So I'll inspect for that. Also, I'll look at respirations to see if there's any type of labor breathing, belly breathing. I'm going to assess for the amount of respirations to make sure they're within normal limits. So I'm going to be doing all that at the same time. Then I'm going to look and I'm going to have him raise his neck because I want to check tracheal position. So what I'll do is I'll put my first and third fingers here on the sternum, and I'll just take my thumb down, and I see that the trachea is midline, so there's no discrepancy there. I am going to inspect the anterior chest, so I'm just kind of going to just feel around, ask if there's any pain or discomfort. Except for me. I'm going to touch them laterally. Is there any pain or discomfort when I touch these areas? Okay, no pain and discomfort there. I'm going to also have him sit up. I'm going to do the posterior as well, and I'm just going to kind of do the same thing. Feel around. Any pain or discomfort. That's palpate these areas. Okay. All right. Let me sit back. Okay, next thing, looking at chest expansion. So usually we're going to percuss the chest. So just kind of looking for rebounding and dullness. So what I'll do is my hands here, kind of for these areas, any pain or discomfort. I'm going to do these things. Same thing with the back side. Alright, so now the next thing that I'll do is I am going to auscultate his lung sounds. First I'm going to do it anteriorly, then I'm going to listen posteriorly. First things first, just going to have him breathe normal. Alright, now I'm going to ask him to take deep breaths. Another deep breath. Listen to him here. Deep breath. And going down to the bases. Deep breath. Deep breath. So when I'm auscultating the lungs, I'm listening for any wheezes, crackles, rhonchi. On auscultation, no adventitious breath sounds noted. Some diminished lung sounds in the bases, but overall everything was clear to auscultation. No rhonchi, no wheezing, things like that heard when listening to the lungs. So next we're going to move on to the cardiac. Same difference. I'm just going to look at the general skin for appearance. I'm going to check for clubbing of the fingers, which is a sign of circulatory issues. Then I'm going to check capillary refill. It should be less than 3 seconds. In his instance, it is. I'm just going to inspect the hands. Once again, like I said, any type of discoloration, any type of clubbing of the fingers. None of that is noted there. Also, I want to look at the extremities for swelling, especially the lower extremities. So I'll look at the legs, have you lift your legs up, lift your pant leg up, please. And then I'm just going to check for lower extremity swelling. So there is some swelling noted in the lower extremities. I would say +1. Edema noted. That's the left lower extremity. So now I'm going to check the right lower extremity. Say more trace edema noted in that extremity. But there is some edema noted in bilateral extremities. I'm going to listen to the carotid pulse. I'm going to palpate again, which I did before, the carotid pulse. Negative thrills. Don't want any bruise. I'm going to do the brachial pulse. Assess for that. Make sure. Yep, bilateral, active, ulnar. Checking those. Dorsalis pedis, which is at the top of the foot. You can take your shoes off for me. And I'm just going to check for the dorsalis pedis pulses, bilateral feet. Here and there, that's indicative of circulation issues. So pulses are felt bilaterally, equal. Also, we talked about capillary refill. I'll look at the lower extremities, and I'll also check capillary refill of the feet. Inspect the toenails. Capillary refills less than 3 seconds. Just fine. Now I'm just going to auscultate the heart. Back for me. Listening for the lift up. Okay. No abnormal heart sounds. S1, S2 was heard. Now I'm going to listen with the bell of the stethoscope to see if I hear any S3, S4, any abnormal murmurs, sounds of that nature. So I'm listening now. Okay, so I listen to heart sounds, listen to the mitral valve, pulmonic valve, Erb's point, listen to the tricuspid mitral valve, no abnormal cardiac sounds heard on auscultation. So that concludes. Oh, one thing I want to quickly add, when I did the HENT inspection, one thing I did forget was to inspect neck range of motion. So I just want to have you real quick, just look at me, sit up straight up. I'm going to have you move your head up, extend, down, right, left. Just kind of go around. Do you feel any pain or discomfort when we do those things? Okay, thank you. That concludes my assessment for HEENT as well as pulmonary and cardiovascular. Thank you.